What if the most dangerous health risk you face isn't loud, isn't dramatic, and doesn't come with alarms, but instead whispers? Quiet signals that something is wrong, but they're so subtle you miss them. That's how breast cancer often begins. Not with pain. Not with fear. But with tiny changes that feel too small to matter, until they do. This video is not here to scare you. It's here to wake you up. Because the earlier breast cancer is detected, the greater your chance of stopping it in its tracks. And yet, every year, too many women miss the signs. Not because they're careless, but because no one ever told them what to watch for. So stay. Watch this all the way through. Because what we're about to walk through could save your life, or the life of someone you love. Here's the problem. We expect danger to look dramatic. A sudden lump. A sharp pain. A clear signal. But most of the time, it starts with something you can barely notice. A bit of tenderness. A strange texture. A slight change in shape or skin tone. Things that are easy to dismiss, especially when life is moving fast. But those small things. They're often the first signs. This is how breast cancer begins for many people, with doubt. Is this normal? Was this spot always here? Am I overreacting? And those questions are dangerous. Because while you're second-guessing yourself, the clock is ticking. So let's get real. Let's talk about what actually happens in the early stages. No fluff. No confusion. Just facts. Because when you understand how breast cancer starts, you're in a much better position to stop it early. It doesn't begin with a crisis. It begins at the cellular level. A few rogue cells start multiplying in the wrong way, forming what could become a tumor. At first, there's no pain. No swelling. No obvious signal. But inside your body, changes are happening. Over time, these cells may form a lump. But not all lumps are easy to detect. Some are deep, small, or hidden in tissue that feels normal. And many women don't check regularly, or they're not sure how to do it correctly. That's why self-awareness, not just self-exams, is so important. You need to know what's normal for your body. So when something changes, you notice. But the signs aren't always physical. Some of the earliest clues are things you feel in passing and ignore. A subtle ache in one breast that doesn't go away. A weird pulling sensation when you move your arm. Skin that suddenly looks different, dimpled, puckered, or slightly red. These symptoms aren't loud. They don't stop your day. But they're not nothing. And then there's discharge. A fluid leaking from the nipple that you weren't expecting, especially if it's clear or bloody. It doesn't happen often. But when it does, it's easy to dismiss. You think maybe it's irritation, or a hormonal glitch. But if you notice anything like that, don't wait. Talk to a professional. Sometimes, the nipple itself changes. It becomes inverted, or shifts position. The area around it thickens. Again, these changes might be gradual. They might even feel like they've always been there. But when something doesn't feel quite right, that's your body asking for attention. And let's talk about swelling. Not a lump. Just a general fullness or heaviness in one breast. Or maybe the texture feels different, like the skin is tighter or thicker. This is one of those signs that people ignore because it doesn't look like what they think cancer should look like. But it's a sign. And the body doesn't send signals by accident. Another warning sign. Pain in areas you wouldn't expect. The underarm. The collarbone. Even the upper chest. Breast tissue extends into these areas, and early changes can cause tenderness there. If something aches and doesn't go away, even if it feels minor, notice it. Track it. Don't explain it away. Here's what all these early signs have in common: they're easy to ignore. They seem small. They're not dramatic. And that's exactly why they're dangerous. Because early-stage breast cancer doesn't announce itself. It waits. Quietly. While time slips away. But if you catch it early, your chances of successful treatment are much, much higher. That's not hype. That's fact. Early detection isn't about fear, it's about power. It gives you more options. More time. More control. And yes, breast cancer can affect anyone. Not just women over 50. Not just people with a family history. It can show up in younger women. It can show up in men. It doesn't follow the rules. And that's why awareness can't just live in October campaigns and billboards. It has to live in your routine. Your attention. Your willingness to ask questions. In the next part of this video, we'll dig into real-life cases. How people caught the signs early, and how others missed them. We'll look at why certain symptoms go unnoticed, and how fear, stigma, and misunderstanding keep people silent. But for now, here's the one thing you need to remember: if something feels different, don't ignore it. Don't wait for it to get worse. Don't assume it's nothing. Your body speaks. The question is, are you listening? Let's take this further. Because knowing the signs is one thing, but understanding why we miss them is just as important. It's not just about biology. It's about psychology, habits, fear, and silence. Here's something people don't always admit: sometimes, we don't want to know. We feel something strange, we see a small change, but we avoid it. We convince ourselves it's nothing. We distract ourselves with work, with routines, with life. We say, it'll go away. But deep down, there's a voice whispering, what if it doesn't? That fear is real. And it's powerful. But ignoring it doesn't protect you. It only gives the problem time to grow. There are real stories behind this. Stories of people who noticed something but stayed quiet. Who waited a few months, then a few more, until the diagnosis finally came, and it was more advanced than it had to be. One woman noticed a tight spot under her arm. It didn't hurt. It just felt different. She thought maybe it was from a new workout routine. She waited 6 months before saying anything. By the time she saw a doctor, she was facing stage 3. Another woman saw her nipple shift slightly inward. It wasn't dramatic. Just subtle. She Googled it, got confused, and told herself it was hormonal. A year later, it wasn't hormones. It was invasive cancer. These aren't rare cases. They're common. And the pattern is always the same: the early signs were there. They just didn't seem serious enough. But what makes something serious enough when the symptoms are this quiet? The answer is, any change that feels new, persistent, or strange is serious enough. Especially when it involves your breasts, your chest, or your underarm area. If it wasn't there before, and now it is, you have a reason to pay attention. The truth is, breast cancer rarely shows up with a giant warning light. It shows up in whispers. And it depends on you to notice. To ask. To check. Let's talk about checking, because many people still aren't doing it. Not regularly. Not correctly. Not confidently. You don't need to be an expert. You just need to be consistent. Once a month. Same time. Same place. Look. Feel. Compare. What's changed? What feels different? What wasn't there last time? You're not looking for something that hurts. In fact, most early breast cancers are painless. That's part of why they're easy to miss. You're not waiting for discomfort. You're scanning for change. And what about screening? If you're over 40, and especially if you have a family history, regular mammograms matter. They catch things you can't feel. They see what hands and eyes can't. But even if you're younger, or don't have family history, staying alert still matters. Cancer doesn't always follow the rules. Now let's address something else that often gets in the way: shame. For too many people, breasts are treated like something private. Something not to be talked about. That silence creates danger. It makes people hesitate to bring up symptoms. They feel awkward. Embarrassed. They don't want to seem dramatic. But there is nothing dramatic about asking a question that could save your life. There's nothing embarrassing about checking your body. There's nothing shameful about taking your health seriously. If you've been putting it off, checking, calling, asking, this is your sign to stop waiting. And maybe you're thinking, but I feel fine. That's good. But symptoms don't always mean pain. They don't always mean feeling sick. Early-stage breast cancer can grow quietly. That's what makes it so dangerous. The goal is to catch it before you feel it. Before it spreads. Before it changes your options. Now let's flip the script. Let's look at someone who did notice the signs early. One woman noticed a small, hard lump, like a frozen pea under the skin. It didn't hurt. It didn't grow fast. But she got it checked. It turned out to be cancer, early, small, and treatable. She avoided chemotherapy. She avoided major surgery. Because she acted fast. Another person felt an unusual warmth and thickening in one breast. No lump. No pain. But something just felt off. She listened to that feeling. Got checked. It saved her life. These are not lucky breaks. These are examples of what happens when you trust your instincts. When you listen. When you act. And here's one more thing: no one regrets asking too soon. They regret waiting. Every time. In the next and final part of this video, we'll cover what happens after those early signs show up. What the next steps are. What treatment might look like if caught early versus late. And how to build habits that protect you without living in fear. Because this isn't about panic, it's about power. And you deserve to have it. So now you know how it starts. The subtle signs. The soft warnings. The things you might have dismissed or been too unsure to take seriously. But what happens next? What if you do notice something? What should you actually do? The first step is not panic, it's action. Calm, focused, immediate action. If you feel something that doesn't seem normal, maybe a lump, a change in shape, a patch of skin that feels different, book an appointment. Not eventually. Not after next week. Now. The goal is simple: get clarity. Not everything unusual is cancer. But only a medical evaluation can tell you that for sure. And even if it turns out to be nothing serious, that's not wasted time. That's peace of mind. That's taking control of your health instead of letting fear or doubt take over. Let's say something is found. The earlier it's caught, the more options you have. That's not just a slogan, it's medical reality. Early-stage breast cancer is highly treatable. Sometimes it's handled with a simple procedure and follow-up. No chemo. No radiation. Just a decisive step taken before the problem has time to grow. But if you wait, the treatment becomes more complex. More aggressive. More life-altering. And while many people still survive late-stage diagnoses, the toll, physical, emotional, financial, is much higher. This is why awareness can't just be a campaign or a moment in the calendar. It has to be a mindset. A permanent part of how you take care of yourself. Not just for women over a certain age. Not just for people with family history. For everyone. Because breast cancer doesn't ask for permission. It doesn't follow rules. It shows up when it wants, and your job is to be ready. But staying ready doesn't mean living in fear. It means paying attention. Building a rhythm of awareness. Learning what your body normally feels like so you notice when it doesn't. Making those quick checks part of your routine, like brushing your teeth. Normal. automatic, smart. And it also means talking about it. Silence is one of breast cancer's strongest weapons. People feel awkward bringing it up. They don't want to seem like they're overreacting. But the truth is, the more we talk about this, the less power it has. You never know who needs to hear it, who's been ignoring a symptom, who's been scared to ask, who's been waiting for a real reason to get checked. This video can be that reason. You sharing it can be that nudge. Because it's not just about your health. It's about the ripple effect. You watching this may lead to someone else catching their cancer early. You asking a question could lead to someone else finding courage. That's how real change starts, not in headlines, but in moments like this. Now let's talk prevention. Can you guarantee you'll never get breast cancer? No. But you can reduce risk. You can give your body the best shot at staying strong and clear. That means movement. Regular physical activity keeps your body's systems working better. It helps regulate hormones, reduces inflammation, and supports immune function. That means food. Whole, real ingredients. Less processed junk. More plants. Healthy fats. Balanced nutrition supports your cells and keeps them from going rogue. That means rest. Your body heals, regulates, and resets during sleep. Chronic fatigue and sleep deprivation wear down your natural defenses. Get the rest your body is asking for. That means less alcohol. Studies have shown a strong connection between alcohol and increased breast cancer risk. You don't need to eliminate it entirely, but cutting down makes a difference. That means knowing your family history, but not being limited by it. If you have relatives who've had breast cancer, talk to your doctor. You may qualify for earlier screenings or genetic testing. But even if you don't have that history, stay alert. Most cases occur in people without a known family link. And most importantly, it means trusting yourself. You live in your body. You know it better than anyone. If something feels off, no matter how small, how strange, or how easy it is to dismiss, trust that instinct. Follow it. Early detection doesn't happen in a lab. It starts with you. With your attention. With your action. So here's what you do now. If you haven't done a self-exam this month, do it today. If you're due for a clinical checkup or mammogram, book it. If you notice something unusual, don't wait. Get it checked. If someone you love hasn't heard this message, send it to them. This isn't about scaring you. It's about giving you power. Power to act early. Power to speak up. Power to protect your future. Because the earlier you act, the more options you have. The more life you get to live. And the more people you inspire to do the same. Let's stop ignoring the signs. Let's stop brushing off what matters. Let's start listening to our bodies, fully, honestly, fearlessly. You're not helpless. You're not alone. You're informed. And that changes everything.